You are called to a local residence for a patient currently having a seizure. Upon arrival, you find a male in his mid-20s lying on the floor, awake but clearly disoriented. The patient's family reports noting the oncoming seizure and lowering the patient to the floor. They report the seizure lasted approximately 2 minutes before he went to sleep. The scene is safe.
Okay, PPE, my scene is safe. Nature of illness is a seizure. Number of patients is 1. I'm going to consider ALS backup, and I'm going to consider C-spine. Hi, my name is Anita, and I'm an EMT. Could you tell me your name?
My name is Mark.
Hi, Mark.
Hey.
What seems to be going on today?
I had a seizure, I guess. I don't really remember it that much.
Okay. Do you know if you hit your head at all?
I don't think I did. My family, I think, put me down on the ground. That's what they told me when I kind of came to.
Okay. So we're gonna rule out C-spine for this one. Let's see. General impression of the patient is poor. He's kind of alert but disoriented. Alert on the ADPU scale. His chief complaint is he had a seizure and he's still a little out of it. I'm gonna check his breathing rate. So got about 20 breaths per minute. And what's the patient's actual breathing rate?
My breathing rate is adequate.
It's adequate.
With about 22 breaths per minute.
Okay, I'm gonna consider oxygen therapy via nasal cannula at 6 liters per minute, just to ensure that he has adequate oxygen since he's not quite alert. And I'm gonna assess his skin temperature and color. What's my patient's skin?
My skin temperature, color, and condition are pale, warm, and dry.
Pale, warm, and dry. Okay. And then I'd like to assess his circulation. So is there any major bleeding?
No.
Okay, I'm going to check his pulse. Got 66 beats per minute.
Right, I have 132 beats per minute.
132 beats per minute, okay. That's pretty fast. We're gonna consider you a high priority transport and get you going to the hospital right away. Could you tell me the onset? What was going on?
I was here at home with my family, and then I don't really know what I was doing, and the next thing I knew, I woke up from the seizure here on the floor.
Okay, do you know how long ago that was?
It was a couple minutes, I think, maybe 2, but I'm not really positive.
Okay.
I'm just kind of tired from it now.
Do you have a previous history of seizures?
Yeah.
And what was the quality of the seizure? Could you tell me kind of how it felt?
I don't really remember much from it. It was pretty intense. I don't know.
Okay. Does your body feel achy, or does radiates is hard. Yeah, do you feel like you have pain or anything anywhere else?
No pain. I'm just kind of tired and washed out.
Okay. And could you tell me the severity of this one on a scale of 1 to 10? 10 being the worst?
I've had others. I'd say this one's a 4 to 5, maybe.
Okay. And did the seizure go off and on, or was it just kind of?
I think it was just on. Just
on?
And
okay.
then off when it was
yeah,
over.
and your parents said it was about 2 minutes. So
I guess that seems about right.
Yeah. Do you have any allergies?
No, I have no drug allergies.
Okay. Do you take any medications?
I do. I take Tegretol, but
Tegretol.
I'm not great about taking it.
Okay. Did you take it today?
I think so, but I'm not positive.
Okay. And you said you have a past history of seizures?
Yeah.
How many per year?
Maybe 2, I guess 3 if you include this one.
Okay. And then how long have you had seizures? How many years?
4 or 5 years now.
Okay. And what's the last thing that you ate today?
I had breakfast this morning. I had like a breakfast burrito.
Okay. How long ago was that?
About 5 hours ago.
Okay. And What were the events leading up to your seizure?
I was just here at home with my family, and then I kind of woke up.
Okay. So at this point, I would do a secondary assessment. I would look, listen, feel. Because he's had a seizure, there's not really much to feel for, but I'm gonna ensure that I auscultate his lungs to make sure his lungs are clear. Do I hear any lung sounds? Any lung sounds?
No lung sounds, sorry.
That's okay. And then I'm gonna just be really observant to see if he has any other seizure symptoms. Let's see, and I'm gonna get a blood pressure for him. So we'll do a thing.
My blood pressure is 132/98.
Okay, 132/98. I am gonna get vitals for him every 5 minutes. We already got his breathing rate, which was 22, and his pulse of
Pulse was 132.
Yeah, pulse was 132. Has his pulse gone down at all?
It doesn't say. So.
Okay,
No.
that's okay. And so yeah, vitals every 5 minutes, and once I'm at the hospital, I will let them know. Patient's name is Mark. He's in his mid-20s. He suffered from a seizure that was approximately 2 minutes long before he kind of went to sleep, according to his family. He was alert but disoriented. He's tolerating 6 liters per minute of oxygen via nasal cannula. He takes Tegretol intermittently. He says he maybe took it today. He has seizures 2 to 3 times per year, and that's happened for 4 or 5 years. Blood pressure is 132 beats per minute. Breathing rate is 22, and pulse is 132. Breakfast was about 5 hours ago, and seen.